students, in today's video on laxatives part 4, we will discuss pharmacology of stimulant purgatives. Now, laxatives are the drugs that facilitate evacuation of bowel and produce relief or provide relief from constipation. Now, laxatives facilitate easy passage or removal of stools from colon and rectum. Now, stimulant purgatives are very potent, in fact, most potent of all laxatives, and produce complete evacuation of the entire colon, usually in the form of semi-fluid stools or watery evacuation. Now, since these drugs exhibit strong laxative effect and result in semi-fluid stools or watery evacuation, they are termed as purgatives. That is, strong laxatives are termed as purgatives. Now, these are of following types. First category is of diphenylmethane. For example, drugs are bisacodyl, phenolphthalein, sodium picosulfate. Then next category is of anthraquinones. For example, senna, cascara. Then 5-hydroxytryptamine 4 agonist. For example, prucalopride. Then fixed oil, for example, castor oil, and miscellaneous purgatives, for example, lubiprostone. Now let's discuss pharmacology of first class of stimulant laxatives, that is the stimulant purgatives, that is the diphenylmethane. The drug is the bisacodyl. Now, bisacodyl is the most commonly used diphenylmethane, and bisacodyl is activated in the intestine by the process of deacetylation. It is deacetylated by intestinal deacetylase and bacterial enzymes to deacetylated active metabolite. Now, this deacetylated active metabolite, it shows laxative effect. It shows purgative effect. Now, this deacetylated active metabolite has dual action in the colon. The first action is the direct prokinetic effect. It increases the peristaltic movements, thereby increasing the intestinal transit at the movement of stools in the forward direction. And apart from this, it also exhibits anti-absorptive secretory effect. It increases the secretion of certain ions in the intestinal colons. It increases the secretion of water in the intestinal colons, thereby softening the stools, thereby increasing the bulk of the stools. Now, this is the diagram that shows the mechanism of action of diphenylmethanes, that is the bisacodyl. This is the intestinal lumen. Here are present the hard feces, and these are the purgatives, that is the stimulant purgatives. Here diphenylmethanes, that is the bisacodyl. Now, bisacodyl acts directly on colonic mucosa. It stimulates sensory nerve endings in the wall of intestine and rectum, and that releases acetylcholine, and acetylcholine stimulates peristaltic contraction of colon, facilitating removal of feces, and therefore it causes defecation. Now, apart from this, bisacodyl also exhibits anti-absorptive secretory effect. It stimulates or it activates adenyl cyclase in the enterocytes of small intestine. Now, activation of adenyl cyclase increases cyclic AMP. Now, increased cyclic AMP induces active secretion of chloride and bicarbonate ions, and this further stimulates passive secretion of sodium ions and water. Now, increased secretion of water in the intestinal lumen increases water content of stools, increases their volume, make the stools soft, and promote evacuation of bowel. Thus, bisacodyl induces its purgative effect by two mechanisms. One is the direct prokinetic effect, and other is the secretory effect. So, diphenylmethanes, that is the bisacodyl, it exhibits direct prokinetic effect, act directly on the colonic mucosa, stimulate sensory nerve endings, and produces parasympathetic reflexes by the release of acetylcholine, resulting in increased peristaltic contraction of colon and that facilitate defecation. Now, second mechanism by which beta-caudal produces purgative effect is by activation of adenyl cyclase in the anterior sides of small intestine. It increases cyclic AMP, and increase in the cyclic AMP induces active secretion of chloride and bicarbonate, and passive secretion of sodium, potassium and water in the intestinal lumen. It inhibits absorption of sodium and chloride in the anterior sides, and stimulates secretion of sodium and water in the intestinal lumen. This increases water content of stools, increases volume of stools, make the stools soft, promoting evacuation of bowels, and semi-fluid stools are evacuated. Now, the next stimulant purgative is the Anthraquinones, also termed as immodants, and the most commonly used anthraquinone purgative is the senna. It is obtained from leaves and pods of Cassia species, and in the colon, intestinal bacteria activates senna and liberates its active anthrol form. And the mechanism of action of senna or the anthraquinones is similar to that of diphenylmethanes. Active anthrol form of senna acts on myenteric plexus, and by stimulating the myenteric plexus, it stimulates peristalsis, and the stimulation of peristalsis increases intestinal transit of the stools, and that facilitate in the easy evacuation of bowel. And senna also promotes secretion and inhibits salt and water absorption in the colon, thereby increasing the amount of water in the intestinal lumen, which softens the stools, and that further facilitates defecation. Semi-fluid stools are evacuated. Now, next category of stimulant purgatives are the 5-hydroxytryptamine 4 agonist. For example, prucalopride. It is a selective 5-HT4 receptor agonist. Now, mechanism of action. Now, these purgatives, they stimulate 5-HT4 receptors on intrinsic enteric neurons in the gut. And by stimulating these 5-HT4 receptors in the enteric neurons in the gut, they enhance release of excitatory neurotransmitter, that is acetylcholine. Now, as seen earlier, acetylcholine increases peristaltic contraction. It promotes propulsive contractions in the ileum and colon, that is in the small intestine and the colon, and colonic transit. That means the transportation or the transit of stools and stool frequency is improved in constipation predominant irritable bowel syndrome. Look at this diagram. It depicts mechanism of action of prucalopride. Prucalopride is a 5-HT4 agonist. It stimulates 5-HT4 receptors in the gut, and stimulation of these receptors causes increased release of acetylcholine. And as we know, acetylcholine stimulates peristalsis. It stimulates peristaltic contractions that facilitate transportation or transit of stools in the forward direction, and further facilitates the process of defecation. Now, the next category of stimulant purgative is a fixed oil. Example is a castor oil. Castor oil is the oldest purgative, and it causes watery evacuation of bowel, that is, it produces watery stools. It is a vegetable oil that is extracted from the seeds of Ricinus communis. Now, castor oil is hydrolyzed in the ileum. So, castor oil is hydrolyzed by the enzyme lipase in the small intestine to produce ricinoleic acid. Ricinoleic acid is the active form of castor oil, which is produced in the small intestine and exhibits the purgative effect. Now, ricinoleic acid is polar and thus it is not or it is poorly absorbed in the small intestine. So, it remains within the small intestine and there it exhibits dual action. It decreases absorption of water, enhances secretion of water, thereby increasing the content of water in the intestinal lumen. That results in the hydration of stools. The stools, they become soft and that further facilitates defecation. So, it exhibits detergent-like action on mucosa. It decreases intestinal absorption of water and electrolytes and enhance secretion of water and electrolytes. Secondly, it irritates intestinal mucosa. By irritating intestinal mucosa, it stimulates intestinal contraction. That is, by irritating intestinal mucosa, it stimulates peristalsis. And stimulation of peristalsis results in the increase in the intestinal transit of stools that facilitates the defecation. And since it irritates the intestinal mucosa, it can produce structural damage to the villus tips. Now look at this diagram, the mechanism of action of castor oil, that is a fixed oil. Now castor oil irritates gastric mucosa, and by irritating gastric mucosa it increases peristaltic contractions. An increase in the peristaltic contraction helps in the transit of stools in the forward direction that facilitates defecation. And apart from this, castor oil also inhibits sodium and glucose absorption in the intestine, in the intestinal mucosa, and that causes increased secretion of water. And therefore, there is increased availability of water in the intestinal lumen, which hydrates the stools, makes the stool soft. So, on one hand, it causes softening of stools, on the other hand, it stimulates peristalsis, and both the processes help or facilitate easy evacuation of watery stools. Now, let's talk about the drawbacks of castor oil. Castor oil is a stimulant purgative. It is unpalatable and causes frequent cramping. There is watery evacuation of stools. So, watery evacuation can cause dehydration. Watery evacuation can cause electrolyte imbalance and after constipation. Now, after constipation is produced because of the complete evacuation of bowel. So, castor oil is not a preferred choice, and apart from this, castor oil may damage intestinal mucosa because it irritates gastric mucosa. So, castor oil is no longer a preferred choice and regular use of castor oil should be avoided. Now, miscellaneous drugs is lubiprostone. It is a new class of medication and it produces secretory effects. It selectively stimulates type 2 chloride channels in the epithelial cells. Thereby, it causes an efflux of chloride in the intestinal lumen. That means it causes secretion of chloride ions in the intestinal lumen, and increased intestinal secretion. Because of the increase in intestinal secretion, stools, they get hydrated, they increase in the volume, they become soft, there is increase in the intestinal transit, and this improves symptoms of constipation. Now, uses of lubiprostone. It is indicated in irritable bowel syndrome with constipation and opioid-induced constipation. Now, let's talk about the general indications of stimulant purgatives. Now, stimulant purgatives are indicated in chronic constipation. Now, as we all know, chronic constipation is a highly prevalent disease. It is most of the times resistant to lifestyle modification and also to different laxatives. Now, stimulant purgatives are indicated in chronic constipation as second line therapy when other laxatives fail to produce or fail to provide adequate relief. And apart from this, stimulant purgatives are also used to facilitate bowel preparation before investigational procedures like colonoscopy, sigmoidoscopy, abdominal x-rays. Now, these are effective when administered to patients with the neuropathy and patients with sluggish bowel. And general adverse effects of stimulant purgatives. Stimulant purgatives can cause diarrhea, and since they are very strong and they cause evacuation of either semi-fluid or watery stools, they can cause electrolyte imbalance, they can produce upper abdominal pain and headache, and chronic use can cause dilation of colon and neuronal degeneration, since they stimulate the sensory neurons of myenteric plexus. Now, apart from this, these stimulant purgatives, they can also cause muscle weakness, nausea, vomiting, anorexia, and rectal irritation. So, this is in brief on pharmacology of different types of stimulant purgatives. If you find the video useful, kindly like, subscribe, and share this video. Very important, please note, information provided in this video is meant exclusively for students from their examination point of view. And kindly consult your physician for the treatment of constipation or for the use of laxatives. Thanks for watching this video.